Good morning, everybody. Doc Dave here again. Thanks for tuning in. I've got a very interesting episode today tailored towards my women audience, and it's going to be titled Women's Health. Now, I'm going to explain things to you that, most of these you're going to be aware of, some you're not. I'm going to try to explain them in layman's terms so that they're more easier to understand rather than, going to your doctor and getting an earful of doctor speak. So today we're going to talk about the most common health issues in women. These are health issues that every woman should understand. And the first one I'm going to discuss, and we're going to go through these one at a time, and there's going to be 10 of them. So hang in there and we'll have a very informative and educational discussion. The first one is heart disease. It's the number one cause in females. Now, a lot of people don't know that. Everybody thinks heart disease is mostly in men, but it's the number one killer in females. So you got to be aware of this, and this is why I'm bringing it up as the number one issue. The symptoms, what are the symptoms of heart disease in females? Well, they're pretty much similar to the ones in males. There's chest pain, shortness of breath, sweaty, lightheaded, dizzy, maybe some palpitations in your chest. The pain kind of radiates up into your neck a little bit and down, usually into your left arm. And, it can last from a minute or it can last for, 10 minutes, depends. And it's what we call angina or chest pain. So if you get these symptoms, don't think just because I'm a woman, I don't get heart disease. You get it also, okay? So be aware of this. This is very important. This is the point I'm trying to get across to people. Risk factors. Well, most chest pain comes on post-menopause. And couple of reasons are, you got hormonal changes, hormones that you had as a young lady, like estrogens and stuff that protect your heart are no longer being produced in your postmenopausal phase. So that's important to know. And other things, just like everybody else, increase in hypertension, blood pressure. If your blood pressure is running high and you're not controlling it, that'll cause, heart disease. Other things are cholesterol. Women, they get high cholesterol just like men do, and sometimes even higher. So it's important to get your lipid panels done, every couple of years and address these, if they're elevated. And, I have an episode in here on cholesterol, which is my most watched or listened to episode. So people take this serious, and it explains all the ratios and everything you need to be concerned about. So, and then like I mentioned earlier, the decrease of estrogen that generally protects your heart premenopausal. Now, the second most common and important disease that women need to be aware about is stroke. Yes, actually, more women die of stroke than men do. So that's, an interesting ratio that a lot of people aren't aware of. And what types of stroke do you get? Well, there's two types of stroke. One's a hemorrhagic stroke, which is a bleeding in the brain. You get a rupture of an artery in the brain, and it bleeds into the brain material and tissue and can cause a stroke from that. And the other one that's, everybody's pretty much aware of is aneurysm. You get an aneurysm, you get a big balloon into your artery there that there's some type of a deficit in the wall of that artery. And as the pressure goes through that artery on every time you have a heartbeat, it pounds against that weak area of the arterial system, and eventually you're going to get a balloon and it's going to rupture immediately. Boom. Not a lot of warning. Bad headache. Yeah, worst headache in my life. That always comes into the ER. Somebody comes in and says, male or female, I don't care what age it is. This is the worst. I've had headaches all my life. This is the worst headache I ever had in my life. Wow. Right off to the CT scan, drop everything. Don't be drawing blood tests and delaying time. You get them right into the CT scan. You squirt some dye in there. You see that aneurysm, and you got to get a neurosurgeon involved pronto. And if you're not in a facility that has neurosurgeons, you need to fly that individual out to a neurologic center that deals with this, and then basically they go in and put a clip, like a staple in there, and that clears that artery from rupturing, and it's very time sensitive. So, and then there's ischemic stroke. That's just the opposite. Instead of bleeding into the brain, you have a clot in the brain, and it blocks the artery that goes to a particular anatomy part of the brain, which can cause various different symptoms and ailments associated with the stroke. Some cause motor weakness, some cause speech weakness, some cause visual impairment, some cognizant problems. So it all depends where in the brain you either get this hemorrhagic bleed or this ischemic clot. Now, what are the symptoms of a stroke? Well, they're pretty common. Most of you already know this, but I'm going to go over them anyway. Just refresh. Difficulty speaking. You're trying to speak, and you either garble a speech, which makes no sense at all, or you just can't form the words. It's very frustrating. Confusion. You don't recognize your children, your friends, your husband or your wife. You look at them like, who are you? So this is confusion. So if anybody comes in with that, you got to investigate it. Weakness in the arms or legs, either weakness or lack of movement. You may just get a complete motor block in your arm. You can't move it. Your arm's just dangling next to you, or your leg. Generally, it starts as weakness, and then it'll progress to, motor inability to move that specific extremity. Facial droop. You always see people, they kind of droop the side of their face. It's actually on the opposite side of where the stroke is. So if you got a stroke in the left side of your brain, you're going to have right-sided weakness in your face, and vice versa. Because I'm not going to go into all anatomy, but the nerves branch over and cross over at a certain part of the brainstem, so that once it gets below the brainstem, then you're going to have the weakness on the side of the brain stroke. But like I say, that's pretty much all you need to know about that. Now, it is associated with pregnancy, believe it or not. People who are pregnant and have a disorder called preeclampsia, which I also addressed on my first, second, third stage trimesters. Preeclampsia is an elevated of your blood pressure during pregnancy. Anything over 140, over 90 is considered high blood pressure in pregnancy. And you usually get swelling in the lower extremities and your calves and your ankles. And if you do a urine sample, you got protein in your urine. And this is all preeclampsia. And the reason they call it preeclampsia, because it can go into eclampsia, which is when you have an associated seizure with the high blood pressure, the swelling of the lower legs, and the protein in the urine. And that seizure can not only be, dangerous to the mother, but it can cause miscarriage. So that's why you go for your maternity checks every couple of weeks, and first thing they do is check your blood pressure. And as long as it's under 140 over 90, then you're generally in pretty good shape. If it's not, then they need to monitor it closer and treat it, dietary, medications, whatever they need. So, and the other associated disorder with pregnancy, other than preeclampsia and eclampsia, is hypercoagulation. Yeah, say that 10 times. And what that is your blood thickens, and either you're getting dehydrated or it's a hormonal thing or whatever, but your blood thickens and it can clot off easier, especially in the lower extremities. And then you break off a clot, goes into your lung, you get a pulmonary embolus. Okay, so that's stroke. Number 3, diabetes. Usually, it's type 2, age-related, diet-related, weight-related, whatever. It's not generally your juvenile diabetes, which you're going to get, usually in your preteens or teens, and that's more of an insulin resistant or a lack of your pancreas to produce insulin. So you got to get, shots of insulin. This type of diabetes, you don't need the shots because you're actually producing enough insulin, but there's a defect in the metabolic and the ability for the insulin to function correctly. So you do generally treat this with oral medication. Now, it has an association of an increase in heart attacks in females 4 times. So if you get adult onset diabetes, like you're 40 or 50, and you think, I'll just take a pill and, kind of watch my diet a little bit. It's very dangerous because you can have 4 times the increase in heart attacks with this. So you got to be really careful with this and make sure your physician obviously is aware of this and treating it appropriately. Now, females, once they get this diabetes, are more susceptible to complications from this diabetes than men are. So, what are the complications? Well, blindness, okay, so you're going to lose your vision. Kidney disease, you're going to go get a chronic kidney disorder, which may cause you to have to go on the dialysis or, get a kidney transplant. You're going to get depression more often associated with this. And you're going to get gestational diabetes. So what is this gestational diabetes? Well, that's different than type 2 adult diabetes in the fact that it comes on during pregnancy. You get an increase in your blood sugar during pregnancy. And this is about 3% of pregnancies have gestational diabetes associated. So when you go to your doctors, and you get your weekly checks, or not weekly, but, maybe bi-weekly or, monthly checks, depending on what stage of your pregnancy you're in, they'll pick up if your blood sugar is elevated. That's one of the things, they always draw in blood tests. You wonder what they're looking for. Well, that's one of the things they look for. So, and this can lead to increase in miscarriages. So you got to be really careful with this adult onset diabetes, that you don't end up, affecting the fetus and end up with a miscarriage. And it also causes an increase in birth defects. So, this is serious stuff. You don't want to have either one of those 2 complications, that you're going to have to deal with for the rest of the child's life. So be really careful with this. And the treatment of this is, how do you treat, gestational diabetes or type 2 diabetes? Well, healthy weight. Yes, healthy weight is good, obviously, at this point. Exercise is good because it lowers your blood sugar. And stop smoking, and so there you go. Always stop smoking. If you need 15 reasons to stop smoking, then, use any one of them. And, good dietary input. Number 4, maternal health issues. So when you're pregnant, what are health issues that you have during pregnancy? Well, one of the most common is iron deficiency anemia. And, I won't go into explain how that happens during pregnancy because it's too complicated. But one of the things the doctor checks when he draws your blood is, if you're anemic, meaning your hemoglobin's under, say, 12.5, it's like 9 or 10. It doesn't necessarily mean you're bleeding somewhere, which most people normally think, well, I'm anemic, where am I bleeding from? It's due to the iron in your system not being carried into the red blood cells and producing additional blood cells in the bone marrow. You need iron for that. Iron is the workhorse of the bone marrow to produce red blood cells. So how do you get around that? Well, multivitamins, generally the vitamins they'll give you during your pregnancy have iron in them. And if that's not enough, ferrous sulfate, that's the iron pill you take. Tastes terrible, causes constipation, but that's your iron pill. So there you go. Hypertension is another maternal health issue. We've already talked about preeclampsia and eclampsia, so we won't go over that again. But the treatment of it is, adequate diet and nutrition will help prevent preeclampsia. Exercise, appropriate immunizations. Well, that doesn't necessarily, prevent preeclampsia, but it's good for your health. You got to have the appropriate immunization. So you got to discuss this with your doctor. What's a good one? What's not a good one? Which one carries risk? Which one doesn't? Which one carries risk if you don't take it? So you got to go with that with your physician. Make sure your immunizations, your MMRs, DPTs are all up to date, and your hepatitis. Now, medications for high risk medical conditions. You got to continue to take your medicine during your pregnancy. People become pregnant, I'm not going to take any, I'm not going to take an aspirin, which is good. I'm not going to take Tylenol. I'm not going to take all that stuff. But you have to take your medicines for your medical conditions. It doesn't do any good if you have high blood pressure and you don't want to take your medicine. You end up with preeclampsia, lose the baby, and other things, diabetes, whatever. So you got to take your hypertensive meds. You got to take your diabetes meds. Blood thinners, obviously, you got to discuss all three of these with your doctor. But blood thinners, you got to be really careful with during pregnancies. But if you need it, you got to protect the mother's health, and then you protect the fetus health. Okay. Number 5, urinary tract infections. Okay, so you get bacteria into your urethra, and it goes straight into your bladder, and there's your bladder infection. Now, why do females get more bladder infections than males? It's not a hygiene thing. It's not any, manipulation thing. It's because they have a shorter urethra than males do. And so the bacteria gets in there easier into the bladder than it does in a male, or it has to travel much further. So what are the symptoms of urinary tract infections, and why is it important to know when you get a urinary tract infection? Because you can get complications from it. Urinary tract infections can lead to kidney infections, what we call pyelonephritis. So not only does the bacteria go into the urethra, but it goes up the urinary to the urinary drainage into the kidney itself. So you don't want to get a kidney infection. Pyelonephritis is very dangerous. You can get sepsis from it. And if it's not treated properly, you can actually lose the kidney. So you have to take your urinary tract infections seriously. And what are the symptoms again? I was going to mention that. So frequency, all of a sudden instead of going to the bathroom maybe every 4 hours like a normal person does, you're in and out of the bathroom every 15 minutes or less. So most people understand if they're going to the bathroom that often and they feel like they just got to turn around and go back in again, 2 minutes later, something's going on. Dysuria. Okay, dysuria is painful urination. Most urinations, you go to the bathroom, it's not painful. If it starts getting painful and spasmy, you got a urinary tract infection. It's not a rocket scientist to figure that out. You call your doctor, say, geez, I'm going to the bathroom every 2 minutes and it's really burning a lot and my urine looks cloudy and maybe smells a little bit. Okay, I'll call you in some antibiotics, go get treated. Now, antibiotics for urinary tract infection and pregnancy are different. You can't be using the same antibiotics that you do when you're not pregnant. So that you need to discuss with your doctor too and make sure you're taking the safe and effective antibiotics. Okay, number 6, HPV. This came into vogue about 20 years ago. Nobody knew what it was before then. Nobody cared. Nobody treated it. But here you go, HPV. 30 times more common than actual sexually transmitted diseases. So it's a human papillomavirus. and it's one of the most common. It's found in 80% of females. So you got to know that you either have it or you're going to have it shortly. Sexually active females, 80% have HPV. And there's 100 different types of HPV, believe it or not. It's just not one. And 14 of them are linked to cancer, specifically cervical cancer in females, which is easily diagnosed by your annual Pap smear. That's why they do the Pap smear. They look for cervical precancer, and that's usually secondary to HPV, and it can be treated if picked up early. And throat cancer in males. So there you go. And it's easily treated or prevented, I should say, with a vaccination, HPV vaccination for females, and now they're even recommending it for males in some places, will prevent HPV infections. So there you go with the HPV. Sexually active, you're in your late teens, going to college. It's almost mandatory now, I believe, when you go to college and you have your physical exam for college, that you have to have your HPV vaccination. Number 7, osteoporosis. Now, that's a weakness of the bone with increased fractures in postmenopausal women. There goes your estrogen again, which protected your heart. Well, it also protected your bones by having the vitamin D absorb more calcium in your diet. And the biggest fracture is your hips. So it's like I say, postmenopausal, you start getting a washout of your bones. Certain medications also cause osteoporosis, medications that block vitamin D and therefore block calcium absorption. You can discuss that with your doctor as well. Low body weight causes osteoporosis, especially postmenopausal, and a BMI of less than 18. I went over this in one of my prior episodes as well about BMI, body mass index. Under 18 is not healthy. So, get your BMI checked. It's very easy. A lot of weight scales like now, even at home, weight scales will have BMIs attached to them. Genetics. Well, you can't avoid that one, but you have to be aware of it. If your mother, your grandmother had osteoporosis, they all had broken hips from minor falls, be aware. It could happen to you as well. How do you treat it? Well, it's hard to treat. A lot of it is vitamins or diet, but exercise, stop smoking, and stop using alcohol. And the exercise is important, especially on weight-bearing bones. Number 8, Alzheimer's disease. Oh, yes. Alzheimer's disease, 70% of all Alzheimer's diseases are in women. So don't think going to avoid this. Only 30% are in men. I didn't even know that. I mean, it's pretty significant that 70% Alzheimer's cases are in women. And what is the reason behind this? Well, some people think it's because women live longer than men, maybe 4 years. And the longer you live, the higher the chance you get of getting Alzheimer's. But the most important one is genetics. If your mother had it, your grandmother had it in relatively early stage, just like heart disease. One of the exams, the histories we get with people that come in with heart disease, well, we say to them, did you have a brother or a sister or a father or a mother that had a heart attack at 50 years of age? Well, yeah, I did. Well, then you're a higher risk. So genetics plays a big factor in this. How do you treat Alzheimer's? You don't. You got to try to prevent it. You got to try to minimize it. And the way of doing that is a healthy lifestyle choices, dietary, and you got to stay active, both mentally and physically, stay socially involved, and eat a good diet. Number 9, save this one for almost last. This is the big dreaded breast cancer. You didn't think I was going to skip that one, did you? It's the second most common cancer in females. What's the most common? I don't know. Anybody have an idea on that? It's skin cancer, because most of them are basal cells, which are just easily removed, but obviously some can be the melanoma. So, 13% chance of breast cancer in females' lives. And that percentage goes up. If your mother had breast cancer, your percent's going to go up, okay? Because there is a genetic connection to that. And it's called the BRCA1 and the BRCA2 gene. If that's in your genetic system that they can check with the DNAs, then you have a much increased chance of breast cancer. So doctors are going to recommend earlier mammograms for those people that have that gene. And even if, they don't have that gene, but their mother had a history of breast cancer, they're going to recommend earlier mammograms. And we'll go over the mammograms now. So how do you detect breast cancer? Well, one is self-exam. That's kind of the most important, because you don't see your doctor once a year, maybe, if you're lucky, especially for your mammograms. But mammograms can miss breast cancer too, but not very often. But if you do a self-exam, you take a shower every day, maybe 3 or 4 showers a week, you're washing yourself, you check yourself, you do your own breast exam, because if you feel something different, then you're going to be the first one to know it. You go to your doctor, he hasn't seen you in a year, he doesn't maybe feel it, or you're your best advocate on this. So self-exam is very important, and look and feel under your armpits as well if you're having any nodes, lymph nodes that weren't there, especially if they're only on one side. So most people know this. Now, the next thing is yearly mammograms, beginning at age 40 now. It used to be, your mother, your grandmother, they got mammograms when they were 60 years old or something like that. Well, now they're doing it much earlier. And if you've got that gene I mentioned earlier, they're doing it even earlier than 40 years of age. Okay, so how do you prevent breast cancer? Well, obviously, you can't really prevent it, but some of the things you can do to minimize the chances of having breast cancer are exercise, stop smoking, healthy diet, and mandatory exams, self-exams and mammograms. There you go. I'm not going to go into all the different kinds of breast cancer or treatment, because that's something your doctor should discuss with you. Number 10. We finally got the number 10, and that's the skin cancer I mentioned earlier about, when I said breast cancer is the second most important. Well, skin cancer, not most important, but most frequent. But skin cancer is the number 1 cause of cancer in females. And like I say, 80-90% of them are basal cells, which are benign. They're not really cancers. They're not going to metastasize. They can go into a melanoma if you ignore them, or, they keep getting the stimulus that caused the basal cell in the first place, which is generally sunshine. So, and then melanoma, that's, how do you know you got the difference? How do you know a basal cell from a melanoma? Well, melanomas, generally you have a mole on your skin somewhere, and all of a sudden it turns black, changes color, has a bluish hue to it, starts to bleed, increases in size. Those are the things you got to be concerned about. How do you prevent this? Well, sunblock, SPA 30. It's got to be a 30. It can't be a 5, 10, or 15. You might as well not be using it. But a 30 is the effective SPA for sunblocks. And how do you treat it? Well, depends on when you catch it. Usually you go to the dermatology clinic and they remove it. It's that simple. They take it out and then they examine it. And if it's a basal cell, they tell you, you're free to go. Obviously, if it's not, then there's more investigation that needs to be done. So the last thing I just kind of want to mention in passing here is, since we're talking about female mental conditions, is gynecological symptoms that you need to have evaluated. So, If you're having bleeding between periods, now it could be just a hormonal imbalance or it could be something more serious. So you got to let your gynecologist be aware of this, especially when you go in for your yearly pap smear. You might want to mention to them that you're having menstrual period bleeding. Now, other things are abnormal postmenopausal vaginal bleeding. Now, that's not normal. So if you're 58 years old, you've been postmenopausal for 10 years, all of a sudden you start having bleeding vaginally, that's not a period. That's something you got to get investigated because it could be an early symptom of a cancerous condition. Other things you got to be aware of, and you're going to know this usually right when you first start having your menstrual periods in your teens, is ovarian cysts and fibroids. Now, as a rule, they're not dangerous, they're not cancerous, but they're painful, and it's a lifestyle issue, and it's painful. You know, when you have your menstrual cycle, you have the heavy cramps, you got localized pain one side or the other. You got you got to get an ultrasound done initially to make sure that that's all it is. And if you got ovarian cysts or fibroids, they're going to have to determine whether you just deal with it or you have surgical removal of it if it gets to be a real issue. And the last thing is dysmenorrhea. Dysmenorrhea is a fancy word for endometriosis, which is a fancy word for increased painful menses. And it's a episode all in itself, and maybe I'll get to it in the near future. But it's painful, heavy cramps during menstruation, heavier than normal cramps, and you get heavier bleeding as well, some clots. And so it's something that, you and your gynecologist need to be aware of and discuss on an individual basis. So there you go. There's our lengthy, educational, informative episode on women's health. I hope you enjoyed this. Make sure you pass this on to all your female friends, family members, loved ones, co-workers. This is a good one to just, hey, you're sitting there having lunch, say, geez, I listened to this really great episode podcast by this Doc Dave, and he just explained everything about female health in 20 minutes. I could spend months on the internet trying to find this stuff, or my doctor never explains this to me, or if he does, it gives me language I don't understand. So this is what this whole podcast is about. This is why I do these podcasts, so that I make it very concise and very understandable, and hopefully I feel really good about you getting knowledge from this, and this is the reason I do this. I'm not in the ER anymore. I retired last year after 50 years. I figured I've given them enough of my life to this. I'm going to enjoy my life from now on, which I'm really doing. But I keep attached with my patients, which I consider you people now, because this is why I do it. I do it for you. And I enjoy doing it, keeps me involved, and I'm going to continue doing this. This is my 32nd, I think, episode. I want to get into the hundreds. I don't know how, I'm going to find that many topics, but, I think I should at least get to 50, if not more. So stay involved, hit the like button, do subscribe. And thank you for your time, and I'll be back for another interesting and informative and educational and hopefully somewhat entertaining episode coming soon. Goodbye for today.